Welcome to Understanding Human Anatomy and our discussion of the pelvic cavity. In the previous two videos on this subject, we concentrated on the os coxae, the hip bone. We looked at from a lateral view and from the anterior view. In this video, we're going to look at the posterior of the os coxae together with the sacrum forming the entire pelvis. So, what I'm going to do is start by drawing in the posterior of the sacrum. And we'll use the tip of the sacrum to represent the coccyx. So there. Clean up a little slip there. And what I want to sketch in is the spine of the sacrum. Again, here's the cutoff to form the coccyx. And we have the posterior sacral foramina. These are where the sacral spinal nerves exit. Put those on each side. So we'll label in the sacrum. And then we'll draw in the os coxae. Then we'll draw in the os coxae. And we'll start with the ilium. And the acetabulum. Then down into the ischial tuberosity, the lesser sciatic notch, the ischial spine, and the greater sciatic notch. On the other side, the ischial tuberosity, the lesser sciatic notch, ischial spine, and the greater sciatic notch. Like so. I'll even up the two sciatic notches. Adding some labels here. We have the acetabulum, which remember is the socket for the head of the femur. The greater sciatic notch the lesser sciatic notch, and then separating the greater and lesser sciatic notch, we have the ischial spine, right here. And then we have the ischial tuberosity. Here we have the sacral spine, running down the middle of the sacrum, and we have the posterior sacral foramina, and we'll draw lines to them. And there are, of course, 5 of the posterior sacral foramina, 1 for each of the sacral nerves. And we have the coccyx represented by this triangular structure. Now, the pelvis has some ligaments here, and one is from the sacrum to the ischial tuberosity, and this is the sacrotuberous ligament. Put the label somewhere here in the middle, so that then when I draw the lines, I can draw a line to each of these ligaments, there and there. And you see that that creates an irregularly shaped hole composed of the greater and lesser sciatic notches and this ligament. We're going to then have another ligament and this ligament comes from the sacrum over to the ischial tuberosity. Like so. And this then is the sacrospinous ligament. The ligament between the sacrum and the ischial spine. Let me draw a line over to it, and then over here on the other side I'll label it also. There. The sacrospinous ligament divides this irregularly shaped hole into two foramina, the greater sciatic foramen and the lesser sciatic foramen. And we'll draw a line to it. And we're going to find that through the greater sciatic foramen pass some muscles, principally the piriformis muscle. We have nerves, the sciatic nerve, and we have, going through the lesser sciatic foramen, also some muscles. And these are all exiting the pelvic cavity. Now, I want to mention a couple of words about the joint between the sacrum and the ilium. This is the sacroiliac joint. And this is the joint right here. The sacroiliac joint is a synovial joint, which means it's a freely movable joint. Although this joint does not move very much. It's held together by very strong ligaments. The articular surfaces are very wide and uneven, so it doesn't allow much motion at all. But it is a true synovial joint. Now, in the next slide, I'd like to look at the articulated pelvis from a superior position. Now, I'm going to start by sketching in the sacrum. And we'll put a central canal here for what will be the cauda equina. And having the sacrum taper down into a coccyx, we'll draw foramina, these would be the anterior sacral foramina. Then we'll sketch in the iliac wings, coming down to the pubic bone. And we'll draw in an ischial spine. Draw in the pelvic rim. And we'll repeat this on the other side. And we'll see some of the obturator foramen in this position. And as I did before, I'm going to join the two pubic bones and indicate the pubic symphysis with the blue coloring. And draw in the other ischial spine right here. So we have the sacrum, here we have the iliac wing, We have the pubic symphysis. Here we have the ischial spines. I'll draw a couple of lines to them. We have the coccyx. We have the anterior sacral foramina. And we'll draw some lines to those. Like so. So that this is the superior view of the pelvis, and we can see the interior of the pelvis, the pelvic canal. The area inferior to the rim around the pelvis is the true pelvis, and then the expanded iliac wings are considered the false pelvis. That concludes our discussion of the os coxae and the pelvis. In the next video, we'll look at the differences between the male pelvis and the female pelvis. Thank you for your attention.